I'm Dr. Thomas Kiska, and I'd like to introduce you to Precision Health Solutions. Precision Health Solutions is an advanced, proactive health maintenance program designed to attain, maintain, and monitor your health. By utilizing your biometric data, which includes your blood pressure, your pulse, your body fat percent, etc., a complete blood chemistry analysis, and a DNA analysis involving over 3,000 DNA SNPs, we help you to make all your dietary, nutritional, and healthcare decisions. Our present healthcare system is simply not keeping us healthy, and this is best exemplified by all the late-stage disease and cancer diagnoses that we see. Early-stage disease, whether it's cancer or inflammatory bowel disease, is detectable in the blood analysis. You can't do 70% of the required blood analysis and tell people they're 100% healthy. I think this is why we miss a lot of these early-stage cancer and other disease diagnoses. With Precision Health Solutions, we do a comprehensive blood analysis. We run that through a secondary service called Science-Based Nutrition for all your nutritional recommendations, but also for an overview, a clinical overview, to make sure we're not missing any early sign of disease. Another example is what we've seen over the last 30 years, and I've witnessed this in practice, is our focus on heart disease, lowering cholesterol, and promoting a low-fat diet. What we've seen as a result of these 30 years is this. We've seen heart disease not improve at all, little or no improvement at that. It is still the #1 leading cause of death in the United States. We've seen obesity triple. It went from 13% to 42% at present, and we see the average person consuming on a low-fat diet 152 pounds of refined sugar products per person per year. In addition, our statin medications cause diabetes. We know that two major comorbidities associated with the deaths in COVID and other diseases are 1, obesity, 2, diabetes. So not only are we not promoting your health, and not only aren't we maintaining your health, but we're actually giving some advice that is actually promotional to disease processes. So let's look at Precision Health Solutions and how we'll attain your health in the first year of our program. On your first visit, you'll come in after a complete history of your medical history, family history, etc. We will take your biometrics. That'll be your blood pressure, your weight, your body fat percent, your visceral body fat percent, your oxygen saturation. From there, we'll identify your blood type. We'll give you dietary recommendations based specifically on the blood type, and we'll also give you informatics on a food elimination procedure diet to help you, and it's a one-time procedure to help you identify food sensitivities to corn, soy, wheat, and dairy products. From there, we'll give you a requisition for LabCorp or for Quest Diagnostics, and you'll come back in 3 weeks and we'll review your blood analysis. On your second office visit, you'll sit next to me on my desk and I'll ask you how you feeling. You're going to say, like everybody else does, I feel better than I felt in a very long time. You'll lose at least 3 to 5 pounds, and your blood pressure will go down, your pulse will go down, your oxygen saturation will go up, and your body fat percent will start to change. So with just this little change of food, and by getting rid of our food sensitivities, and then we'll identify our food sensitivities to those 4 food groups. From there, I'll have a written report for you that I'll review with you, and it is your blood chemistry analysis that's based on science-based nutrition's evaluation. They'll review all your drug-nutrient interactions. They'll screen it for any early type of disease processes, and then they'll prescribe, based on your blood analysis, a nutrition program with the vitamins and minerals and herbal extracts that are specific to you and this blood analysis. From there, we'll take a cheek swab from you, or we'll get a DNA sample from you, and then we'll see you again in 3 weeks. On your third office visit, we'll review your DNA genetic analysis. That'll be a 60-minute sit-down with the doctor. From there, we'll review over 3,000 of your DNA SNPs, how they work individually and how they kind of integrate together on a meta-analysis. We'll compare that against 900,000 data references to provide all your genetic information. We're able to take your genetic fingerprint, if you will, of all your different biological organ systems. We can look at your gastrointestinal area, we can look at your female reproductive area, we can look at your male reproductive area. And one of my focuses is really type 2 diabetes. I can take the person who is considering type 2 diabetic medications, and I can cross-reference for over 21 DNA SNPs related to pancreatic cancer, which is now our 6th leading cause of death in the United States. So we can kind of help you make not only your nutritional recommendations, your nutritional decisions, your dietary decisions, we can also help you make your medical decisions, because there's a lot of natural healthcare strategies that work with the management of most health conditions. My message to you is, let's stop assuming we're healthy, let's stop guessing on what diets we should be on, what nutritional items we should be taking based off what is on the web out there these days, and let's get down to a very scientifically enormous amount of data based, your biological bioinformatics, and let's make our health decisions based off those. And that's what we do at Precision Health Solutions, and I'd like to welcome you to Precision Health Solutions. I'm Dr. Thomas Kiska.